Combating Zika virus in Paraguay, a community-based approach. Program overview. This program aims to reduce the incidence of Zika virus in Paraguay through a multifaceted approach involving community engagement, education campaigns, enhanced surveillance and monitoring, and strengthened prenatal health services. This program is designed to be cost-effective as well as sustainable by leveraging community resources and proven intervention models to achieve positive public health outcomes. There are multiple evidence-based interventions that will be implemented within this program, including community engagement, education campaigns, surveillance and monitoring, as well as enhanced health services. Community-based intervention strategies aim to promote the health and well-being of a community in the context of people's everyday lives by engaging local resources, networks, and cultures. Education campaigns provide an important role in changing social norms by providing facts and information to members of a select community. Studies show that community-based interventions are effective in controlling vector-borne diseases. Our social marketing campaigns will change behavior and promote healthy outcomes in this community. Screening and early detection, as well as management of cases, can reduce the amount of outbreaks and the amount of negative outcomes associated with Zika virus. By strengthening prenatal care services, we will be able to monitor and manage these pregnancies that are at risk of Zika virus. The health belief model predicts that specific behavior is more or less likely based on an individual's perceptions of a disease severity and personal susceptibility. We aim to change behaviors through educating the community on the severity of Zika virus and its negative outcomes, as well as how a community can prevent the spread of Zika virus. Through community-based participatory research, we will engage the community with certain interventions that will change behavior and eventually will become self-sustainable changes.
Timeline and program plan. So our timeline will begin from July 2024 to June 2025, and it will be implemented in 5 phases. Within each phase, we will look at project launch, community engagement, implementation and surveillance, ongoing health enhancement, and evaluation and reporting. And as you can see within both, here are more information. Not only that, but communication plan. So we'll be using the SWOT analysis and 4 Ps to make sure that the community is being ensured. So it will look at the strengths, weaknesses, opportunities, and threats, and these will help focus our concerns on where to improve our program. And the 4 Ps are product, price, place, promotion, and this will allow the public to know about this project along with ensuring that Zika prevention is being done. And potential community partners and resources needed. So we'll partner with the Administration of Health, Public Health, local health department, healthcare providers, and community leaders to ensure that Zika prevention is being done. And resources needed will be training materials, educational materials, technology for surveillance, and tools for prenatal health.
The program integrates modern surveillance technologies such as GIS and mHealth with no traditional community-based approaches to effectively combat Zika. This hybrid model aims to reduce Zika cases by 50% in targeted regions within 12 months, improve community awareness and preventative behaviors, and enhance prenatal care services to manage Zika risk in pregnancies. Key process objectives include conducting 50 community cleanup drives within the first 6 months, organizing 100 educational workshops to reach at least 5,000 people, and implementing a surveillance system covering 80% of the targeted regions. Outcome objectives target a 50% reduction in reported Zika cases by the project's end, a 70% increase in communities' knowledge about Zika prevention, and ensuring 90% of pregnant women in the targeted regions receive enhanced prenatal care services. Monitoring the program will involve regular process reports, community feedback sessions, and health data analysis, while evaluation methods will include pre- and post-intervention surveys, health records analysis, and tracking participation numbers. Sustained community involvement, local champions, and partnerships with health departments and community organizations are essential for the program's long-term success. These efforts will ensure the program's effectiveness and sustainability in controlling Zika.
It is vital to continue to sustain the Zika efforts currently happening, creating a space where the community feels empowered to take ownership and continue participating to ensure the sustainability of the program. Some of these participating events may include cleanup drives, education initiatives, and even surveillance activities. In order to keep high level of local involvement, there must be meetings in place to provide a space for feedback and adapting the current strategies if needed. Not only can they lead by example and allow collaboration with local organizations to continue health programs, and other resources may address the challenges and prevention of Zika. Utilizing the established infrastructure and leveraging what is currently in place, this approach will allow the individuals at risk to receive proper care without creating a burden on healthcare systems. Aligning our programs with public health initiatives, we may remain sustainable. Community engagement activities are crucial for fostering a sense of ownership and responsibility among community members, ensuring sustained participation in Zika prevention efforts. Following with education campaigns the community on how to protect themselves and their families from the virus. Surveillance is necessary to identify risk areas and implementing target interventions to prevent outbreaks. Lastly, health services ensure access to quality health care services and essential for timely diagnosis, treatment, and support of individuals and families affected by the virus. These investments are crucial for implementing comprehensive and sustainable strategies to combat the spread of Zika within our community. We have allocated $200,000 over the course of 12 months. This budget ensures comprehensive efforts in combating Zika while prioritizing community engagement, education, surveillance, and healthcare provision.
All programs need some type of seed money to get the program off the ground. While Paraguay is considered to be a middle-income country, in 2021, the national poverty rate remains at about 30%. Throughout our program implementation, we will utilize our budget and maintain our objectives by sticking to our timeline to reach our goals. Our community-based approach will remain sustainable post-funding through the ongoing community engagement, local partnerships, as well as the training of local healthcare workers and community leaders to ensure continued efforts to control Zika outbreaks.
Here are our citations. Thank you.